Hi, this is Bill with OPP. Today we're going to talk about oxygen in your operating room. And one of the big questions is, can you put manual tanks in your operating room versus having a piped-in medical gas system? And the answer in most jurisdictions is yes. Now, of course, before I go further, check with your local city, state, and county ordinances because it can vary, but for the most part, and this includes CMS, you're allowed to use manual tanks in an operating theater, but there are definitely some things you have to keep in mind compared to having a piped-in medical gas system. So number one is the monitoring of those tanks. Now, obviously, you're not tied into a medical gas alarm system. When you have manual tanks, that's going to require visually logging and monitoring their capacities and what's to remain of their volumes. This needs to be done meticulously on a daily basis, especially depending on the volume of cases that you're doing in that operating room. So you really want to make sure you always have enough sufficient supply left somewhere else in the facility, properly secured and ready, and that you're logging this and documenting this at all time. That's a very, very critical point. Number two is also the way you position them and mount them in your OR. Obviously, especially in earthquake-prone regions, you want to have the right proper mountings and support to the walls. How they're chained, how they're bolted, how they're basically fixed is a very important component, especially during accreditation and CMS surveys. So you want to really be able to document and show how you'll be able to protect the integrity of those and prevent potential fires and other catastrophes with, open, unsecured oxygen tanks is not a good thing, obviously. And for the most part, there are different codes that look at the varying amount of oxygen you can store. There's something called the International Fire Code, which is basically predicated on roughly about 504 cubic feet of oxygen, which translates to about 2 full tanks. So, for the most part, keep in mind that when you're using medical oxygen, it is really, really important to have the kind of oversight, documentation, and proper follow-up to make sure you're using it properly and monitoring at all times. So follow us at OPP for more information on ways that we can help you with your operating room.